Welcome to our first mental health workshop. I would like to introduce our guest, our distinguished guest, Mr. Chairman Rupani Sahab, to please come here and say a few words.
Thank you, Mariam, for your kind introduction. Thank you. I'm just a social worker, but they, I would say, respect and support all the work. So, again, good morning, everyone. Thank you all for joining us today. I can't forget Ibn Sina team. Ibn Sina team, great work. I think this is beyond their call. Look at their here on Saturday. I believe we have so many challenges, especially in mental health. I think we must strive and do our best to look at which conditions our new immigrants, our refugees, our undocumented low-income families who are living here in Houston are not getting access to mental health. But I don't want to take thunder away from our speakers, so I can speak, but I'm not an expert, but I'm learning with all of you. I'm also here to come to listen to our experts. But again, thank you very much for all of your support, and thank you for being here.
So what I'm going to do next is I'm going to just introduce Dr. Waji to come and take the mic.
Good morning, everyone. Good morning. I think we need it louder. Welcome to the Oasis Center and welcome to the seminar. It's been a privilege and an honor to work with the Ibn Sina team to curate these 4 workshops that we're going to have over the period of the next 3 to 4 months. Very briefly describing our goal, I'll just reiterate it one more time, that really it's you, the leaders, the influencers here, who will do some learning here, will educate each other, and then go out in your communities and go for it, that we create that awareness, as Mr. Rupani said, in every language, in every culture that we possibly can, so that we all benefit from the learning that we have from such eminent scholars that we have here. So, without further ado, I'd like to welcome Dr. Shah here. He will be doing his keynote presentation. We're going to have some fun when we're going to discuss some myths and facts about mental health. And then we have a rare opportunity to have a one-to-one, a Q&A with Dr. Shah. So with that said, please welcome Dr. Shah.
Thank you. So what is the definition of mental health? What is mental health? How do you define it?
The mental health definition is different for everyone based on their own understanding, right? There is no definition of mental health which is standard, right? So that's the beauty of mental health. What's your definition of mental health may not be your definition of mental health, may not be your definition, may not be your definition. But the bookish definition is mental health includes our emotional, psychological, and social well-being, and that's kind of what you guys said. It also says it affects how we think, feel, and act. You kind of said that too. It helps us determine and handle stress. You guys mentioned that too. It is important in every stage of our life, from childhood to adolescent through adulthood. So it kind of encompasses everything you guys said. But the main message is mental health has no one definition, and the definition can change from person to person, point to point, age to age, and situation to situation. That's one thing. Then comes, what are the types of mental illnesses? So psychiatrists define mental disorders into different groups. The first group is anxiety disorder. And in anxiety disorder, we include PTSD. In anxiety disorder, we include obsessive compulsive disorder. In anxiety disorder, we include OCD, all those in anxiety disorder, because they have an element of anxiety. That's one group of disorders. You mentioned disorders. Second group is mood disorders, which includes bipolar and depression. What's the difference between bipolar and depression? Anybody knows? And to have a diagnosis of bipolar, you need to have just one high in your life. So even one high in your life at the age of 18 will make you have a diagnosis of bipolar the rest of your life. Which people object that I've never had any highs except for one. I've always been depressed. Why call the diagnosis of bipolar? But that's enough for the diagnosis. The third is schizophrenia or psychotic disorders, which is a thinking problem, a thought disorder. What does it mean by thought disorder? These are people who have delusions. How do you define delusion? But delusion's definition is fixed false belief. When somebody has a fixed false belief. I work in the ER. I've seen Jesus, I've seen Trump, I've seen everybody. People come and say, I'm Jesus. That's a fixed false belief. People come and say, I have 20 million in my account. What are you doing in Punjab then? I mean, if you have 20 million in your account and they don't have any shoes or anything. But I mean, people have, those are delusions, right? Fixed false belief. Delusion, that's delusion. Then hallucinations, hearing voices of people not around you, seeing visions. Those are all thought disorders, either schizophrenia or psychosis. Paranoia, feeling people are following you, people are after you. Those are all in schizophrenia or psychosis. Then personality disorders, complexes, borderline personality, manipulation. Those are all in different kind of personality disorders. But there are many personality disorders. Borderline is one, but there are many personality disorders. Dependent personality disorder, OCD, avoidant personality, paranoid personality, multiple personality disorders. Then cognitive disorders, dementia, intellectual disability disorder, IDD or mental retardation. Those are cognitive problems. Those are also affected. And then eating disorder, as somebody mentioned. So the difference is anxiety disorder is one spectrum, mood disorder is another spectrum, schizophrenia is another spectrum, personality disorder cannot be modified with medications. Cognitive disorder cannot be modified with medication, and eating disorder is a separate spectrum. Out of these, which one is the most common psychiatric illness? It is anxiety, which is the most common, followed by depression. Okay? Okay. Now, when do these illnesses start? 1/3 of all mental illnesses start before the age 14. That's the reason we, as a psychiatrist, emphasize in picking up signs and symptoms in school, in young kids. Why? Because if they're going to start in young kids, we need to pick up these illnesses in school age or in young age. Because if you're going to miss them, you're going to miss them in school age. And then they will be full blown. And then by definition, any illness, if you don't treat, is going to get worse, right? So if you treat them early, you can treat them better. But if you don't treat them early, it's going to get worse and worse and worse. So you treat them early. Substance abuse also start early, and we'll talk about substance abuse also. Okay? What's in between 50 and 90? 75. 70 is the answer. Okay? And unfortunately, we live in Texas. Texas is the last for the access of children's mental health services. Depression. If somebody has depression, how long do you treat depression? Second question. What is the most common risk factor for suicide? What percent of patients with depression have anxiety? Okay, let's just talk about depression. So depression is very significant, of course. While anxiety is very common, it may be milder than depression. Depression is very significant. Does anybody know what percent of depressed people commit suicide? About 10 to 20% of mood disorder people commit suicide. About 10% of schizophrenic people commit suicide. About 10% of personality disorder people commit suicide. So 10-10 in mood disorder is 10 to 20%. Depression is one of those things which is always underdiagnosed, undiagnosed, misdiagnosed, undertreated. Why? Because people think of it as anxiety or bipolar or so, give people Ativan, Xanax, those kind of things, and wrongfully diagnose it. Women are depressed more than men. Do you know why? Yes, somebody said something. Yes, please. No, go ahead. Yes, you're absolutely right. Women are... One second. So she said women get depressed more because they live with men. Okay. 1 second. So she's right. But men get psychotic more because they live in India. See? Okay. Women get, but the correct answer is women get depressed more because of hormones, because of estrogen. And because, to be fair, they have a more sensitive personality and they are more caring. So these are the symptoms of depression. Out of these symptoms, which symptom is the most significant, or one symptom which is the most important to make the diagnosis of depression? Lack of interest is one symptom which is the most important to make the diagnosis of depression. And let me explain why. Have you ever seen a depressed person with lots of interest, enjoying life? I mean, if you're depressed, you're not going to enjoy life because you're depressed, right? So actually, if a person comes to me or comes to us and is showing interest in life, they're not depressed. They're just telling you they're depressed, because depression will take away interest from life. Sleep in depression can be up or down. Some people sleep too much, some don't sleep. Guilt, yes, they're guilty, but they can be guilty in other things also. Why they're guilty? Because somebody is telling them, this is all your fault. This happened because of you. People make them guilty. Energy is decreased in depression, but energy is decreased in anxiety also. Concentration is decreased in depression, but that's decreased in anxiety and in ADHD also. Appetite can be increased in depression, but some people eat too much in depression too. Psychomotor retardation, yes, is there in depression, but sometimes it can be agitation also. Suicidal thoughts are there in depression, but not every single person with depression, not 75% of the people in depression are committing suicide. So it is the interest, which is I like to associate diseases with one symptom. If you remember one symptom, you can make the diagnosis. You all can become psychiatrists with one symptom. Interest. Interest is the key for depression. The diagnosis of depression is you have to be clinically depressed for 2 weeks. The symptoms which we mentioned need to happen for 2 weeks or less if you are suicidal and hospitalized. Dysthymia is a low-grade depression, same symptom but low-grade, but lasting up to 2 years. It used to be called dysthymia, and now we call it persistent depressive disorder. Bipolar 1 and 2, what is the difference between bipolar 1 and 2? In 1 you have mania, in 2 you have hypomania. What's the difference between mania and hypomania? Hypomania is a lesser degree of mania, meaning if the volume of manic symptoms is 10, which is high, in hypomania it will be 5, kind of less. Adjustment disorder. What is adjustment disorder? That is situational depression, meaning we see a lot, especially in the emergency room. Broke up with a boyfriend, depressed. Got a new boyfriend, better, more happy than before. Situational depression, right? That's not clinical depression, but it happens, right? So that's situational depression called adjustment disorder. Or slashed your wrist because broke up with a boyfriend and then happy again, found him. Or, divorces. But some divorces end up in happiness also. It just depends. It just depends. It just depends. It just depends in which relationship you are, right? But that's situational depression. First episode of depression, we usually treat up to 9 months. You have been depressed one time in your life, and we're talking about 2 weeks of depression. You treat 9 months. You have been depressed 2 times in your life, twice. We treated 2 years. Why? Because the chance of recurrence is up to 70%, meaning it can happen again. So you treat it for 2 years. If somebody has been depressed 3 times in their life, then we treat it forever. So for simplicity, remember 1 episode of depression, 1 year, 2 episode, 2 year, 3, forever. What are the treatment options for depression? Of course, the first is psychotherapy. Psychotherapy is, yes, it's talk therapy, but there are different kind of modalities. CBT is a good therapy for depression and anxiety, cognitive behavior therapy. There are other kind of therapies also. And it's a good treatment option, but the problem with psychotherapy is that you need to be committed. You need to go for 8, 10, 12, 16 sessions. You're not going to get better in 1 session. And if you go every month, then it's not going to change the course, because that's called more supportive therapy. So if you really want to get better for your depression or anxiety, you need to go every week for 12 or 16 sessions. But if you're going once a month, you're just going to say, hello, hi, how are you? I'm fine, all of that. That's not going to change anything. That's going to make the therapist a little richer, yes, which is fine for the therapist, but not going to change the course of the therapy, sorry. So please go on a regular basis to get better if you want therapy to improve. Okay, the other options are ECT, which is actually the best treatment, which is the best treatment for depression. Medications have a success rate about 40%, 44%. ECT, 70%.
Yes, one shot.
You get 3 ECTs, Monday, Wednesday, Friday, you're better. Medications take 6 weeks. ECT does the same thing as medication, but quicker. So it releases the same neurotransmitters from the brain. It happens under local anesthesia. It's not like they plug the same, that I'm going to put you here and put you under the electric current. No, it's not that. It's not that. It's a little harder than that, no. So, but it's a very good treatment, and it is very safe. It's safer for elderly, it's safer for pregnant, it has no weight gain, it has no sexual side effect for men. It's a very good treatment. Intranasal ketamine. Ketamine is also a treatment for depression, but there is an intranasal spray which you can use. But does anybody know the cost of that spray? So one spray is $744, and you have to use 2 sprays a week. It is an option, and actually the good thing about intranasal ketamine called Spravato, actually we did study on that too, is that it is approved to reduce suicidality in 20 minutes. One more thing about antidepressants. A lot of people take antidepressants, and I don't need to know who takes antidepressants or not, but you may know people who take antidepressants, right? Okay. So antidepressants can cause withdrawal symptoms. That is something to know. That's the reason I was asking. So which antidepressant can cause withdrawal symptom? Which antidepressant can cause the most withdrawal symptom? And what are the withdrawal symptoms? That's something for you to know. The worst antidepressant to cause worst withdrawal symptoms would be Paxil, number 1. Paxil is the worst one. Number 2 would be Effexor. Number 3 would be Cymbalta. So these are the 3 worst ones. Paxil, followed by Effexor, followed by Cymbalta. What are the symptoms? Symptoms are nausea, vomiting, diarrhea, irritability, anxiety, lightheadedness, dizziness, vertigo, all those symptoms. To the point that people just feel that they're depressed again and they restart taking the medicine. They feel that they're depressed, although the depression comes back in 5-6 months, not in 3 days. These happen 3 or 4 days after stopping the medicine. So that is the reason we never stop antidepressants cold turkey. Now about anxiety, and again, Xanax is the worst one to cause withdrawal. Xanax withdrawal is so bad that people can have seizures, and so bad in the ER that they become almost psychotic. It's horrible, the worst withdrawals. So, okay, anxiety. What is the one word about anxiety we said?
Worry.
Yes, worry. Anxious people always worry, 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 worry. So one word to remember to diagnose anxiety is worry. And the worry is about what? Future. Future. Depressed people are always past-oriented, focused on the past. Anxious people are always future-oriented. Yes, yes. And if the worry is lasting 6 months, it's called generalized anxiety disorder. So worry, 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 future, anything, worry, 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 6 months, generalized anxiety disorder. So the medications for anxiety are almost the same for treatment as depression. If you see, 30% is anxiety, about 16% is depression. That's the most common is anxiety, followed by depression, and then bipolar and others are much less than. Schizophrenia prevalence has stayed the same all along, which is 1%, hasn't changed any. Again, anxiety is also more common in women because we make you anxious, and again, you make us psychotic, like I said. So it is 60% of the people with depression have anxiety, and 60% of the people with anxiety have depression. That is the reason we try to use one of the SNRIs or SSRIs like Prozac, Zoloft, Lexapro, Celexa, Effexor, Cymbalta to treat both because they will help treat both. That's going to be the answer. Which substance is the most common in Houston? Okay, so alcohol is there, marijuana is there. After these two, the most common in Houston, Harris County, and Fort Bend also, is cocaine. Yes, but cocaine is not rich people's actually. No.
Really? It's cheap.
But meth is picking up, and meth is coming close to cocaine. So alcohol, marijuana, then cocaine, and meth are the way it is, and even PCP is common. Even there was a time when we had, synthetic cannabis, which is Kush. Now we don't have it a whole lot. And bath salt was also common at some point. And bath salt was so bad that people were eating human flesh. Yes, you can even Google and see human flesh. People were eating human flesh. Bath salt was that bad. Now, how much alcohol is normal to drink? So if you're less than 65, less than 4 a day, less than 14 a week. And if you're female, less than 3 a day and less than 7 a week. When I say less than 7 a week, some women don't like it because they're like, oh, I can drink 7 a week. But women's tolerance is higher, and 7 a week is the tolerance for women. And that qualifies them to be an alcoholic, unfortunately. In pregnancy and less than 21, of course, there's nothing, which is legal. You guys mentioned caffeine. US is #1 for caffeine, especially for these drinks, these Red Bull kind of drinks. If you see other countries, how much we use and how much other countries use, we are way high in terms of that. Nobody uses these other than us. And then you mentioned vaping. Vaping is a new problem we have, and the problem with vaping is that people don't consider vaping as a problem, but it is a huge problem. And it is used in schools, which is the biggest problem. Schools, marijuana used to be #1, now vaping is #1. Next to vaping, there is another issue which is cropping up, which is hookah. Hookah bars. Everywhere hookah bars, which is another problem, and even women are doing it. Women are doing it more than men actually, in front of their kids. In front of their kids. And I don't know what the kids are going to learn with that, but everybody's doing it. And there's so many hookah bars. And hookah is, some studies show hookah is 100 times more potent than a cigarette. 100 times. Again, like it says, it's addictive. It's a gatekeeper drug, causes heart and lung issues. There are multiple lung issues involved with vaping, including lung collapse and everything. It has all the harmful chemicals and everything. Suicide. So every 11 minutes, there is one death because of suicide. Every 11 minutes in this country. About 50,000 people die of suicide each year. 50,000 people die of suicide each year. Every 11 minutes, one death. And that's very sad. But even more sad than that is that 250,000 people are suicide survivors. And while people who have died, we can try to save the suicide survivors. Why? Because every survivor will try again. So if all of you sitting here can save one of those suicide survivors, this seminar has done something, right? So please think about that we need to do something about suicide survivors. Because if 250,000 people are suicide survivors, you may come in contact with somebody or a family who knows somebody. If you can educate them, teach them, tell them something about something, that is going to help. We used to have 911 about 2 years ago, 16th July. We developed a mental health line, which is 988, which is the answer of all mental health crises. Just dial 988, it will take care of everything.
No more? It's no more?
What is that? 988. So the risk factor for suicide, #1 is prior suicide attempt. Anybody who's tried to commit suicide, that's the #1 risk factor. Now anymore, we don't consider slashing of the wrist as a suicide attempt. That is called self-injurious behavior. That is not a suicide attempt. So just remember that. Tylenol is actually a very dangerous drug. So Tylenol, extra strength Tylenol, a lot of people take 500 milligram. We take 2 of them. It's very normal. And if you take 8 of those extra strength Tylenol and you are starving, and if somebody is drinking alcohol, so you have to be very careful with Tylenol. Again, these are the risk factors listed for suicide. So there are places people can go. The best is to call 988. I'm going to end here.
I will just stand and say thank you, Dr. Shah. This was great and this is very helpful. Really appreciate the commitment and support of the community. And all of your audience, this is a very important information. Don't keep it to yourself. Share it. Share it with your family. Share it with your friends. In the community, wherever you go. Because this information that you are hearing must be disseminated. Don't keep it to yourself. Please, thank you.
Thank you all.
Thank you so much, Dr. Shah.
Thank you everyone for sharing a part of yourself, and I think one of the reasons we're here today is to make sure that you all know that there's a part of you that can be a champion in mental health. And when we're training in graduate school, we spend quite a bit of time on listening skills. And I always say, you know, if listening is an art and not everybody is an artist, it's a skill that we can really work on and improve. So today I want you guys to really lean into the human part of listening. So keeping that in mind, we have these case scenarios that we would like for us to get into groups and maybe even like look at from a fresh lens, right? What would you do with a case like this? And then I'm going to go around and I'm going to kind of help you guys distinguish between, like, is this something that could be maybe handled at a community level, or does this need a referral, or do you guys need more resources? So this case is actually a real case. Like some of my interns put this information together. So a body of a 19-year-old Neil Lakaria was recovered on this university campus. The pressure felt by Asian American students to excel academically had led to incidents very detrimental to one's mental health. Neil always felt in competition with his peers to not only make his parents proud, but also achieve excellence at his school. Everything for Neil has always been driven by competition, and for him there was no coping mechanism for when things got difficult. He usually shoved all of his issues under the rug to avoid getting behind or showing vulnerability to his parents. Now, when I read this as a clinician, a lot of red flags are going on, but I'm just wondering if we were to present this case maybe to groups of 3 to 4 of you guys, where would be the starting point, right? When you hear this, maybe you're the friend of the parent of this 19-year-old. What would you say? You know, one way to get over the hurdle of the mental health stigma is to learn how to have awkward conversations, right? And to normalize having awkward conversations. Or when you ask someone, how are you? Really be ready to maybe take on some responsibility, and not for us to just roam this world and be fake to each other and let these things go on with our youth and family members.
What we would suggest would be that within the groups of 3,
yeah.
This is like segment 1, it's Neil's home environment. So maybe somebody takes a role of Neil himself, Neil's parents, and there's a conversation going on the dinner table or whatever, based on what Neil's struggles are. So that could be, one way of being able to do that. Or, you could discuss the actual scenario that we have as to how would you do this. Because what I see here is so much experience in this room from what I heard, the facts that we heard. So we're here to learn, we're here to share, And really, these are things that typically will come to you when we go to our communities, and that's what we are preparing ourselves for. So let's go for it.
And she mentioned a good point. Like most likely, there's other kids that have
but if there was
getting the same care.
And one thing, Fiza and I, we worked in school and we talked to a lot of parents about these kind of scenarios. Yes, I think we all discussed the cause behind it, but I think the question was how to prevent. I want to add one thing, and I was telling my group members that, I mean, it's the ideal scenario if a child comes to someone, I mean, they come to someone and ask, okay, I'm at the breaking point and I need help. Or if a parent comes to the counselor and say, okay, how can I help my child? This is like a perfect scenario. I think, again, like we all are doing it right now, creating awareness is the only way to prevent these kind of issues. And when I say creating awareness, to be really honest, I think creating awareness about failure. When we talk, even someone come on the stage, we talk, okay, they done this, they have these titles, we don't talk about their failures. Embrace the failure, that if someone becomes successful, there are lots of failures behind it. There are lots of years of struggles, failures behind it. We always discuss success and how to become successful. We don't discuss failure, and when these kids are not ready for failure, it's not just from parents, it's from societal pressure, peer pressure, the standard of how to become successful, and if they do not find themselves fit in with these parameters, they can collapse. So if you become successful, I encourage every single person, please discuss your failure with the youth, because nothing can possible without a failure.
I love that.
I always say to my clients that there is no failure. No failure in life. Because these are our tiny steps towards success. So because we have some norms for failure and success, so we should talk about that. These are, I mean, this is necessary because if I understand for myself that I'm a failure, so where I'm standing. So locus of control must be in that.
No, my point is not I am a failure, but if you become successful, please embrace
the steps there.
The struggles. I am not becoming successful. I have some failures in life, and I embrace it as a lesson.
Plus capacity, capacity.
I love that you're making a reference to transparency, and I think I mentioned it earlier too. When in our cultures we love to showcase, and there is some authenticity that's lost. I agree with you.
So now you shared your story. I think everybody in the room can connect. When we talk about human connection, that's how you make connection. If I come in the room and I say, okay, I am the perfect therapist, coach, whatever, nobody can connect with me. I have to say, okay, I'm just like you. I made mistakes. I learned all. And that's how child can connect with you. Even with parents, I want to show it to my daughter that, okay, I made a lot of mistakes in my life. I can't come here just like that.
Exactly.
But that's the great segue that you gave. Now we have Neil. He's meeting with a counselor. And we want role play. Mahtab is a counselor. We're looking for a Neil.
Hi, good afternoon.
Good afternoon. So what brings you in? How did you hear about us?
A friend of mine told me because there's a lot of things going on in my life. My dad and my mom, they are very reputable somebody in the community. They have been pushing so hard. They want me to be a doctor. And I told them several times, this is not for me. But especially my dad, he won't listen. He just says, either you take it or you leave it. And with that word, I don't want to offend my dad. I mean, scripture says your parents, you just have to respect them. I kept telling them, this is not for me. Right now, I'm doing so bad in class. I like music. In my class, people love me when I sing. They love it. But my dad said, no, this is not for you. You can't even bring this into the community. So this is my problem.
It sounds like you carry a lot of pressure. being their son. Is there part of your life that you live for yourself? Like, do you get to have some musical outlet? You said you mentioned you love music. What are some coping mechanisms that you currently
So
have?
that music thing, I only do it when my parents are not around. They don't want to listen to music in the house. So this is what I love doing.
Okay. Between mom and dad, is there one parent that you feel a little bit more comfortable kind of being yourself around?
Mom.
Okay. Tell me about the last conversation you had with your mom about who you want to be.
So each time I talk to my mom, she was like, I don't want trouble with your dad. You just have to listen. He's the man in the house. He's the breadwinner. I know you. Oh, sorry. So each time I talk to my mom, she's always ready to listen to me. But the downside of it is, she say, hey, I don't want you to offend your dad. You know, is the father. I don't want trouble with him either. So meaning she's telling me, I'm okay with you being whatever you want to be. But I'm also afraid of my own life. I mean, I've been raising you. Your dad can be
Okay. It sounds to me like even your mom is walking around eggshells.
Right from the beginning, that is the way we are. Even my siblings, they know. My dad is, we call him no nonsense. You know, whenever he says like this.
Give me an easier one. Do you think what would your dad say knowing that you were sitting here today?
Oh, my dad? What will he say?
Yeah.
He's always telling me, you either take it or leave it, meaning you must be a doctor and you can do it.
Well, what would he say if he knew you had reached that threshold that you needed help? Do you think he would still be very fixed on you becoming a doctor, or do you think he would actually care that?
No, he will insist that this is what I want for you. I never disobey my parents, and you won't be the one to disobey me.
Do you think your mom or dad would be open in joining you in our next conversation?
Actually, my mom will be ready, but I'm still afraid that she don't want to be confrontational with. They've been together for a while. They've been married for 5 years. I don't want to be the one causing problem between them.
I hear a lot of guilt and fear, but I'm sure at the very core, your dad really cares about you as a person. Maybe we can create some opportunities for new communication to happen. Would you be willing to let me help facilitate some?
I'm happy, but I doubt whether she can manage.
Okay, well, you need to send him my way. Let's see what we do.
Thank you.
Good point.
Thank you so much. You've been a wonderful audience. Talking about court reporters, I cannot help but remember a story that I'll leave you with, which is a story by Mullah Nasruddin. Some of you may know him. He was a very witty character. Some say he was from Turkey. The Iranians claim he's his own. I don't know who is Nasruddin. But, so Nasruddin was made a judge. And he listens to the plaintiff and says, "You're right." So now the defendant says the judge has already made up his mind. Still, he mustered up enough courage to go before the judge, and he presented his case. And Nasruddin said, "You're right." So now the court reporter is saying, "But Mullah, who is right?" He said, "You are right too." The idea of, validation of everybody's sensibility, not being hypocritical, but that's a lesson that we learn. But I will leave you, with this thought. We were going to have one more segment, which we will not labor you with. We'll do that next time. Just to say that our core idea here is to raise awareness of mental health in our own communities. That is our mission, we cannot forget that. And having said that, I just want to paint one scenario. Imagine one of you standing up here with a room full of 50 people from your community, and that you're going to transmit whatever we have gained from these wonderful conversations from Dr. Shah, from Mahtab and all the other experts. How are we going to distill that and present it to our communities so that we are able to put through the awareness in what we have learned here? That is our task, ladies and gentlemen. And as we go through, we will, present you with enough tools and so on and so forth. But that is our task as this group. So we hope that the second seminar that we will have here in a month's time, we'll let you know what the date is, we'll be able to spend some more time on communication skills, presentation skills, and the tools that you will have, because the expectation is, and you pledged, all of you pledged, that after the second seminar, you will be ready, God willing, to present whatever we have learned in the 2 seminars to your communities. Because the need is dire, the need is urgent, we cannot wait. So with that, Rupani sir, please.
This is information to really navigate the clients or your friends or family, navigate them. Don't become an expert. Hey, I'm an expert and I'm going to do this, right? So please don't be expert. This is just a tool to give you also some sense of navigation and do the shepherding, that direct them. If you see in the community or in your friends or family, you see the challenge, navigate them. So that's why we are here to really help you set the direction. We have a resource guide, right? Those are resources that you need to give them, say, here are the resources, please use those resources and basically navigate them and shepherd them. Do not try to be an expert, because it can become a challenge. So try to just navigate and shepherd your family and friends. And that's why Sina has expanded our services. We have hired 10 more counselors and treatment providers. So we are available to you all in your community that if you need some help, we are here.
The Oasis Center is a third space for discussions of this kind and other kinds, where we come here, we discuss, we learn from each other without judgment. It's really a third space. So if any of you have any specific ideas of holding and sharing your knowledge with the rest of the community, the services of the Oasis Center are also open to you. With that said, we say thank you very much.
Thank you.